just like to enter you, we need the proof. We as doctors, one, there has to be. Okay, for an infection to occur, mudema want for an infection to occur. What the can
infection to occur?
Yes, there has to be one.
Mwabewa janyambako bikonkomemu.
Gamba root.
Root.
There has to be a receptor.
Receptor.
There has to be enough pathogen. Enough pathogen.
Enough pathogen.
Enough what?
Pathogen.
For an infection to occur. For enough what? No, there has to be enough pathogen. What I mean, a pathogen means the germ or how do I explain it in layman's language? There has to be enough pathogen, not pathogen. Not pathogen, not pathogen. Pathogen. There has to be enough pathogen for a contagion to occur, not a contagion for an infection to occur. There has to be enough pathogen. Yes, pathogens. I want international model.
Wanji.
Please go and Google and bring us a picture of a pathogen, how it looks like for your fellow interns and students to see. Okay? There has to be enough. What I mean is, there has to be enough. Echibaliriro chechi amount.
You know,
please give this patient 1 milligram of an antihistamine called prednisolone. Please give her prednisolone. 1 milligram of prednisolone. Okay, now what I mean is chigero chobulwadde chigero echiwuka. Yes, now that is a pathogen, so it has to be enough for the infection to occur. Yes or no? Are we together? Good. Now the pathogen, the root is, it depends. It could be, the root can be either on the surface of the skin and it bites. It could be through inhalation. Inhalation means either through the nose in air and you inhale it. It could also be through ingestion. Ingestion, you could eat it and it enters what? Your bloodstream. Okay? Now, this patient here, the pathogen entered through all the roots. All the roots, microbiology, not about money SN. All the roots, it entered through the skin, it tapped the hands, then it entered through the nose, and because the pathogen was gassing, the carrier was gassing. And like it entered through, and then the patient ate. Our patient ate the pathogen through very small money. I will buy you champagne, I will buy you food. The patient ate. That is why I tell you, please always avoid eating everything you see. You are just there eating. Avoid overeating. The patient ate the pathogen. The patient ingested the pathogen. The pathogen can also gas. Hey, okitege luno lwa VVIP kati kadama anyize tabitegeera. Anyhow, so our patient on that day, this after ingesting everything, this is what laba nono agamba mbu Senga, please talk about Keem. Imagine ndiwo kubategeeza mbu no kirasi ya biology and medicine microbiology, only the smart ones pass it, only the smart ones pass it, only now lwaba VVIP abasomako bokka oluzungu lungi, biology mungi, critical analysis and active listening. Yes, please listen, do not talk unless you wanna ask. Anyway, so ladies and gentlemen, class, so our patient ate, our patient ingested, our patient inhaled, and the pathogen also bit through the skin. And it entered through the muscular system, and it entered onto the nervous system, the central nervous system, and the central nervous system also got affected. The central nervous system got affected. It affected the brain. It affected the speech was impaired. It impaired understanding and expression. It triggered the anger. The patient was very, 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 very insufferable, unmanageable. Unmanageable. Ladies and gentlemen, our patient after that, this is how, after they ingested and everything started, they went to a function that is called UNA. UNA is a conversion. It is usually by Ugandans. I think it is Ugandani. Can you please tell me what UNA is in full? UNA. Those that know people, we have Artigo, we have Mande Artigo, we have Movax. What is UNA, please? UNA? What is UNA in full? Please write, Americans, please write UNA in full. North America, no, not North America. What? It is UNA. It is Uganda North American Association. Yes, Uganda North American that is student. Our student called Anthony Kess has answered what everybody could not. Thank you, student Anthony Kess. You have passed that one. Thank you very much. So they went to UNA, and according to an eyewitness, according to our clinical research officer that was in the field trying to gather what's happening with our patients, this is what they gathered, especially when they tried to do wait. 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 Don't move, please. Don't move. I want to give you, I'm reading here, clinical research. Abasawo, please, doctors, when you are on site, EMRs, please, emergency responders, when you reach on site, what do you do? Of course, after putting on your PPA, what do you do? This one where we check the head and then, no, you do eyes and then responsiveness and then you see patient is breathing, responsiveness, and then you do like that, and then you test, not vitals, not vital signs, please. Not vitals, not essentials, not examine full body assessment. Yes, I know it is full body assessment, but it has initials. I'm forgetting, please. No, not CPR. Temwasuma. Now I know. Not physical exam. Not CPR, not first aid. I want to see people that went to medical school. Please start, not vitals. GCC, not GCC. Not GCC. Muzimu aberawo yenna nga yefula eyasoma muzimu yanguwa. Emergency responders, please start. What did you ask? I asked, when you arrive on site and you find a patient, what is the first assessment you do before OPQRST? What is the ABCD? Thank you. That one, Lady Juliet, ABCD. ABCD is you check the airway. Wait. ABCD, you check the airway, you see if the patient is breathing, you see if the patient is conscious. And what is D? What is D? What is D? Hurry up. A is airway, is clear. B is patient is breathing. C, patient is conscious. When you say, hello, can you hear me? Do you know where you say? They say, yes, I have a headache. You say, now, patient. What is D? Hurry up. Daddy. C is circulation. Yes, sorry. C is circulation. No. C is not dead. Disability, no. You say airway. C is A is airway. B is breathing. C is circulation, where you touch here and you're like, yes. What is D? Anyway, katugende maso. When after that one, you do the head to toe. You do that. No blood. Come here, and then you ascertain. Is it trauma or medical? Defecation. Muzimu, today I knew to anything in medical. Saturation, exposure, it is not exposure, sorry. Anyway, so you ascertain, is it trauma or is it medical? Ladies and gentlemen, we ascertained that the problem is medical. The problem is medical, and that medical. So our patient, the problem was medical. Yes, now, did you? Babe, please, Doctor Okampereza. Okay. Please, don't talk back to the doctor, please. Doctors, we have a lot of things. When I ask something, so this is what happened, and I will replay for you what our clinical what our clinical Okay, so this is what happened. Okay, ladies and gentlemen, we started like this when our clinical officer, our clinical research officer that was on site, this is what they
Senga bitandikidde kwena video ejola berimu omukazi omusajja ayambala ebiteeteeyi eby'abagole.
First of all, our officer on site, First of all, our officer on site was confused if patient is male or female. So ladies and gentlemen, when we are giving a report to the doctor, we did not know whether it's male or female. You know where you say, oh, doctor, we are having a female adult, approximately age ABCD. They did not know whether male or female. Like you have also heard, they did not know whether the patient is male or female. Okay?
Anyway, I don't know. Kati, Bobatu say, Kimagara Nicola Grant, Anyo ya sneakinga in Naingra Nanga Yemola Mola. Senga bitandike depana video jola very much omukazi oyo omusajja yayambala ebitete by'abagole bamuyitaani oba essemulaani oba yani I don't know.
Ladies and gentlemen, the person that our patient was with is also they them oba musajja wattu oba mukale kintu kyattu, but is called Mother Nature. Say nti Mother Nature right over there, Mother Nature. She called Mother Nature. Okay? Yes.
Boba tuuse eyo kimwagala nnyo kola grand entrance nga abantu bonna batudde yasena janga ali mu bishort byawo nga yeisa mondoza nasalinga mera nalwanga abantu bonna batudde abantu babadde bangi nga even some people don't have seats naye abagenda nga bafuna seats ey'emabega. Oyo wazze nayagala akole grand nadde n'ayambala ajja akole grand entrance aze n'oyo wakati teika abagole. Omusajja nga abagamba eri emaga nga walina gye balina okutula nga bagamba siiti zaabwe babafunde siiti erebaga nga gatula nawe wali bazawedde wali abagundi abo. Kimlaavu ng'afightinga mpaka le bamufulumizza. Bakwaka video ke babadde nga bamuwala wala bamufulumya. Nadde bwe natandika okwoga n'akola commotion. Kati bw'atandise okulaba n'atandika okukira nga bamusindika ningamba fans tukengende nga kwati. Abantu bangi yadde batekinga videos. I'm thinking they're going to post them. Ne batandika okwefula nti takyagala kuyingira ne baleeta poliisi ne baleeta aba security. Batandika n'okuwa music ne bagamba haba ngali ebwerwawo gana biki awo mudda akoze eki omusajja ayimidde ku mulyango oyo omunene n'amugaa tugenda kuyingira. Luvannyuma nnyo yaapasini nengamba nze kingenda okukolera ngenda kukolera abantu.
Mazima gamba nti ngenda kukolera ki abantu. Bannange clinical officer yakoledde abantu ekisooka kya byonna clinical officer yakoze atya yakoledde abantu ekyokusookera ddala obubonero clinical officer first hand informer yakuta omulwadde nga tali mu favorite firuta gamba nti favorite ki firuta era mwenna mwagenza okufuna akali mu firuta bannange nga clinical research officer nga yakutete muli firuta baddi yalenga ebirevu tubirabanga amanege galebeeta baanamwe oli omwana nagambye nze wano nina okukolera abantu era yankubidde kumaliri nangamba senga asidi yanguwa nina agatalinda patient afudde nti patient ambulance munonye nga tategeera munange awaawo wenyini kati awo kwe kubuuza naye olwo nga virus Mayuga aliwa.
Zawede tasitudde na lugalo kuba gye badde bamugaana okutuula eri abadde bazawedde ne babushoke.
Ekisooka, all of us know that virus comes to penetrate through the root ingestion and all those things and then enter you. Aliwo kutta kuzikiriza na kukola ki na kusaanyaawo era bino byonna nga bigenda mu maaso yatudde bwati nga VIP.
Nandowooza bazawedde kuba nejjo
kakati awo nga yenna atudde agamba I have done it finally the Lord has done it finally nga ali eya akola ki celebrating. Ladies and gentlemen, now wetwatuusaawo clinical officer n'akola OPQRS. Ladies and gentlemen, for those ones that do not know OPQRS batandika 1. O stands for when did you last have any Okay, OPQRS kale mutandike njagala kulaba abaana bange ab'omu kibina. What is OPQRST? Mwanguwe. OPQRST on set. Thank you Zamad. Thank you Zamad on set. What happened? What was not oxygen please? Omwana tugambye on set what exactly happened? Otyo what is P? What is P? Wandika what is P? What is P? Provocation, pause. Provocation means embere no kubeerawo kiki ekyabaddewo. What happened? What provoked this patient okubeera nga ali mu mbeera eno? What is Q? What is Q? What is Q? Quality inti omulwadde ono obulwadde bwe buli ku level ki on a scale of 1 to 10. How would you rate the what this patient is going through? Yes, and what is R? What is R? Patient, what is R? Region. Region is where is it? Chiri mutwe, chiri mugongo, chiri dawa olina agamba mubiri gwonna. What is S? Radiation is it moving? Is it only there? Where is it? Nagamba chiringa chirwadde chiva ku mutwe na chikirira ku meme onana mbekuma bamba. S is severity is on a scale of 1 to 10. How would you rate your pain or symptoms? Nagamba 10 over 10. Nagamba 10 mbuno ndi bubi nnyo. It is 10, that is the severity. And T means what is T? What is T? What is T? Tandika. What is T? What is it? Time. What is it? Time. When did this start? When did this start? Nagamba it started about 2 years ago. 2 years ago, last year. It started about a year ago, and it was when the virus broke up with a beautiful girlfriend called Dr. Acid, blah, blah, blah. And then I went there to make sure I get some food from the virus, blah, 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 blah. And then I entered, that one now. Ladies and gentlemen, OPQRS, this is what we were trying to ascertain such things. Now this is what we got.
Boti yawadde mulese katuna kabe twabadde tumulese ku boti.
Wait a minute.
Yazamanyiza Zawede emide ku mulyango oyo munene namuga tugenda enda kukolera abantu. Keem asaga. Zawede tasitudde na lugalo kuba gye badde bamugana okutuula eri abadde ba Zawede ne babushoke nandowooza ba Zawede kuba nejjo boti yawadde mulese katuna
kakati wano tuliko OPQR ST into O is onset kyatandise ddi owulidde kyatandise ddi what happened like before all this what happened ne batugamba ejjo yagenze ku boat ku lyato
kabe twabadde tumulese ku boati yazamanyiza Zawede yamusasulidde ate nga teyabasasulidde era yabadde afisse neegayira awo nagamba yina tumusobola kinkola biki n'amala oba abantu bamugiridde ssente waliwo yamufumidde ssente naye nga yabadde asigadde nga Zawede teyabasasulidde yadde omuna gw'ekyensi
wadde omunyoga najja ne mbagamba omukazi yayavuwala gamba nti Senga said it. Gamba nti Senga said it nti omukazi yayavuwala era abanjibwa. Banange Katonda njagalanga gwatalitta. Gamba nti Senga said it wandiikaawo. She said it. Senga said it nti omukazi yayavuwala. She cannot even afford a simple boat. A simple boat, Mayuga, you cannot afford a boat to pay for 1, 2, 3 because these boys were 2 people. You cannot afford it to pay money for 2 wololos of yours. I said it. Did I or not? Did I or not? Was it me? Yes, it was me. This time I said it. I saw it and I said it. Nembagamba omukazi abanjibwa. Nembagamba omukazi yayavuwala takyasobola wadde okwafoodinga.
Zawede wadde walina ebushoke ng'atudde n'ekiro Spice Diana yazinye yabadde ayimba nga the highest bidder goes to nga amugira n'ayimba n'addamu oluyimba lwa City Regular. Kati omusajja Zawede
kadama tuli mu Amerika gamba nti tuli mu Amerika abalwadde ba Amerika olwaleero dokita akoleddeko mitala wa mayanja mu Amerika machi mu Amerika
yaabwe nga offering $5 omusajja naga Spice
Diana
kati omusajja Zawede n'amuyita agenda ayimbire ku kebo yaabwe nga offering
ndako katon
nga amugira n'ayimba n'addamu oluyimba lwa
ndako
era Zawede wadde walina ebushoke ng'atudde n'ekiro Spice Diana yazinye yabadde ayimba nga the highest bidder goes to nga amugira n'ayimba n'addamu oluyimba lwa City Regular. Kati omusajja Zawede n'amuyita agenda ayimbire ku kebo yaabwe nga offering $5. Omusajja naga Spice Diana nkuwalukulu sigala wano oyimbe City Regular times 5. Zawede era olwagize yamaze n'anyiiga
Mayuga nga tasobola kusasula Spice Diana. Katonda anjagalanga gwatalitta kati awo yenza abuuza yenze mwana wa Sitaani Mayuga ye mwana wa Sitaani. Mwe bannanga abaana ba Katonda batakolera muli kuki mwe nga buli kaseera Katonda abasuwaza buli kaseera God is embarrassing you. I said Mayuga does not have money to pay people. Nembagamba Mayuga abanjibwa yalemeddwa okusasula kano kapaati ka Spice mukawulirize.
kebo yaabwe nga offering $1 lwamugiridde ssente waliwo yamufunidde ssente naye nga yabadde asigadde nga Zawede teyabasasulidde yadde omuna gw'ekyenyi
talina ssente.
era Zawede wadde walina ebushoke ng'atudde n'ekiro Spice Diana yazinye yabadde ayimba nga the highest bidder goes to nga amugira n'ayimba n'addamu oluyimba lwa City Regular. Kati omusajja Zawede n'amuyita agenda ayimbire ku kebo yaabwe
Pozi ngako Keem aina oluwumu olwo si luwumu zooming in si luwumu olwo mwe. Our patient has another disease. It's a skin condition. It is called ringworm. This is ringworm. The patient has another fungal disease. Oh my God. Ringworm. Ringworm. Mama. It is contagious. Oh, what is it? Ringworm. Don't over zoom in. Just a little bit, not too much. Either it is lumbugu, chisipi. Chisipi is called happy zoster. Happy zoster. That is happy. Yes, that is happy zoster. Happy zoster. Oh my God, the patient has happy zoster. Patient has happy zoster. Can I please have another set of gloves? I have to put on extra PPE. Extra PPE. PPE is personal protective equipment. If this patient has the happy zoster, I have to put there is a watch out for diseases like HIV. Yes, for HIV. It is not a must for every person that has the happy zoster to have HIV, but it is a symptom because it is as a result of compromised immunity. Can I please have an extra pair of surgical gloves and please with an extra layer? Thank you. Allahumma swali. Okay. Now, nkomyewa. Yes, I need to put on azamat suit. That is true.
Faringa $5. Omusajja naga spice dana nkwala 10 sigala wano oyimbe siri regular times 5. Zawede lwagize yamaze n'anyiiga n'atambula nawe babushoke ne bagenda. Enga mukwala. Kimulabo ali wano yeekaza yabadde agira isigena kuddamu kuyingira. Yo, I'm done with you guys. Biki. Ayingite dali yakoza bintu n'olutete yalushusa n'ateekamu oluteteeyo olulala. Nga yeebuzaabuza naye mukwano. Zawedde talina kyamuyambye yadde. Kabali nakaagi n'ebushoke we. Ozaba baleebesi bushoke yabamugana. Abaana ngabeera mu yuna nga basitula omakuta sawo omulala akutola olugero Zawedde mabega ne bw'oluba terwekulula. So, ali awo.
Ekisooka, I want to give kudos and a very big thank you to every our clinical research officers. We thank you so much. Because every time you go over there, mutukawo, you're an emergency responder, you're trying to research, you're trying to gather notes and to let the doctor know what happened and how to start. Banange mwebale nnyo, mwebalire ddala. Era mwenna aka video mwakalabye oba tukaba playingire tutandike. Kati nga tutandise okulaba ekirwadde ekyomulwadde ebyabaddewo byonna mwenna mulaba omulwadde waffe ono ayina something that we call gender apart from ekyabaddewo eno virus omulwadde waffe ayina by the way mulindeeko by the way. Students, say yes, doctor. Say yes, doctor. There is something on OPQRS. The first one is the primary one. Primary one, which is a primary survey, okay? Primary survey. Then, after the OPQRST, we have a secondary one. Say a secondary one now. The secondary one, who can tell me? Who can tell me a secondary one where we have underlying conditions? If you're taking any medications, muandikao, please. The banange akagamba ko ketu abbreviating the gundizi bakaita batya. Nga olaba OPQRS, forgetting the word. Sample. Thank you, sample.
Doctor. Outfit mwali mumuwadde ki? Pamper.
Okay, let's start on sample, please. Sample, what is S? What is S? Student signs. Yes, signs. A. What is A? Not speed. It is the signs and symptoms. A. What is A? Hurry up. A. Do you have any allergies? Yes. Allergies. M. Do you have any underlying medical condition? Do you have any medications? P. What is P? What is P? Mwangwe, what is P? Yes, M is medication. Past history. L, last oral intake. Yeah? Last oral intake. E, what is E? What is E? Events. Thank you. Events. So the sample signs and symptoms, we were there and we saw our patient trying to get hysterical because the patient came in and went out. Already people had sat and we said, this patient is exhibiting signs and symptoms of the Mayuga syndrome. Did the patient contract the virus? Then we said, does the patient have any allergies? They said yes. The patient is allergic to anything that relates to his gender. What do we mean? The patient does not want any male near them. The patient does not want any male voice talking to them. The patient does not want any trousers or shirts for men. The patient, anything related to being male, the patient is allergic and it triggers an allergic reaction. Okay, so the patient was triggered. The patient has allergies. Yes, the patient has allergies. And we asked, does the patient take any medication? They said yes. This patient takes attention medications every day because the patient keeps taking medicine every day to make sure that they don't get out of character every time attention is taken off them. Then they asked, when did